empowering patients to become consumers again. Look, women make 80% of the healthcare decisions for families. And by empowering them, by showing them prices and putting money in their pocket, rather than asking, does my insurance coverage cover this or not, it's going to start bringing prices down. But there's more to it. We do need some type of reinsurance pool to take care of the high-risk people. We would like to have association healthcare plans. We're saying Amazon or a Costco, something like that, could sell health plans across state plans and use the power of bringing lots of people together as well.
As an economist who studies how we pay for healthcare, I have a lot of interesting thoughts about Senator Roger Marshall, who is the senator from Kentucky, and his health plan, or rather, should I say, concepts of a health plan. And this plan has come about since the Affordable Care Act enhanced subsidies expired at the end of 2025, and senators have been trying to come up with healthcare plans that will replace them. And I've made several videos talking about some of these components that I'm happy to go more into detail. However, today I want to specifically talk about what he mentions at the beginning of the video. And that's this idea that if we gave people, specifically women who make 80% of healthcare decisions, if we just told them the prices of healthcare and we gave them more money, then that would lead to lower healthcare costs because people would just decide in the free market what healthcare they need. First of all, this healthcare plan just fundamentally ignores basic concepts of economics, right? Buying healthcare is not fundamentally the same thing as going to the grocery store and buying Nerds gummy clusters or Airheads or whatever candy you like that day. If you go to the emergency room, right, with chest pain, you don't know what healthcare service you need because you don't even know if you're having a heart attack or you have acid reflux or you have cramps. You are relying on an expert, a doctor or a nurse or other medical professional, to run tests to provide a diagnosis for the care that you need. And then once they figure out the diagnosis, then they can tell you what healthcare products you might need. But the thing is, right, is that number one, time is of the essence in healthcare, right? You might not have time to compare prices across all of these different hospitals to decide whether you want care in hospital A versus care in hospital B. And the second thing is that the consequences of saying, I do not want this medical service, especially in an emergency situation, are much more literally dire. And so this idea that we can just leave healthcare decisions to the free market, and as long as we increase transparency, that will solve all of our issues within US healthcare, ignores basic economics, right? And what's interesting about this is we actually have evidence, right, from price transparency rules to demonstrate this, because this current administration in their first term passed some rules related to hospital price transparency. So since January of 2021, we've actually had this price transparency rule in place. And essentially what this rule stipulates is that hospitals must have prices on their website in a machine readable format that lists out the gross charges as well as the reimbursements for several different types of medical procedures across different insurers. And if a hospital doesn't have these listed, they're then subjected to a financial penalty. And so theoretically, with this price transparency rule in place, we can have a version of what Senator Roger Marshall has projected. This idea that people, if they have access to prices, can shop around and decide what healthcare is best for them, which could lead to lower prices. But in practice, does that actually work? And we actually have data from this price transparency rule that can show us what has happened since then. Now, the first thing you need to know is that for this rule to work, right, most, if not all, hospitals have to be in compliance. Most, if not all, have to be showing their prices, right? Because if hospital A shows their prices, but you can't see the prices for hospital B, how do you know if you're getting a good deal or not? And actually, the Department of Health and Human Services Office of the Inspector General found that only 50% of hospitals were actually in compliance with this rule. And of course, the hospitals that were not found to be in compliance were actually these larger hospitals that could take on the financial penalties that would result if you do not list your prices online. However, let's assume that all hospitals are actually in compliance, right? What does the economic data show about how much people pay for healthcare if they have access to price transparency? We actually do have a study from the state of Florida that looks for exactly this. And the findings show that yes, it does work, but only in very specific circumstances. Specifically, if patients, right, are paying for services out of pocket, so they're not using their insurance, and specifically if they are looking at elective procedures. Elective procedures are procedures that are typically not emergencies, right? You have time to shop around and look for costs for things. So for example, a hip or knee replacement is an elective surgery. What's important though is that the price transparency rule does not reduce healthcare spending in emergency situations. Again, because if you're having a heart attack, you're not going to have time to look up the prices of the treatment for said heart attack and direct the ambulance to go to hospital A versus hospital B. So, does the price transparency rule reduce spending for American families? Technically, yes, but in very, very specific circumstances, right? If patients don't have insurance, which I guess a growing number of Americans are uninsured, so that applies to them, but also if they are purchasing elective procedures, which only account for about a third of total US healthcare spending. However, if we're considering the majority and the main reasons why healthcare costs in the US are so expensive, simply making prices more transparent according to the data ignores the fundamental issues. Now, again, I would love to talk about other points that Senator Marshall brings up in his healthcare plan, especially as senators look towards the midterms and realize that they haven't done a lot of things in healthcare aside from taking away insurance and making it more expensive for a lot of folks. But for now, that's all I got. And as always, if you have any questions, let me know.